The additional reimbursement for meaningful use for a electronic health record is still being defined by the Federal Department of Health and Human Resources. We believe that Eastern Maine Medical Center is well positioned given the language that's in the bill right now, but we need to wait and see for the actual decision to be made by the Secretary of Health and Human Services. We believe that we're positioned well both on the hospital side and on the physician side. Computerized provider order entry is mentioned in the bill. It's not clear if that's going to be a minimum requirement, but it's probably highly likely given that it's mentioned in the bill. Also, the bill mentions having alerts for patient safety, reporting of quality measures, and ability to provide information in a health information exchange. For example, we went from the time it took to deliver from when a physician ordered a medication to when that medication was delivered. We went from over 200 minutes on average down to about 24 minutes on average. So that speeds up getting the kind of care that patients need. We also measured that we reduced blood transfusions significantly. For example, in one pilot group of orthopedic cases, we went from 37% of patients having blood transfusions before we started with the electronic health record and actually focusing on reducing unnecessary blood transfusions down to almost zero. It's very important for the whole administration to have the vision and the chief medical officer to also be a champion for the electronic health record, because we had, through the medical staff, made computerized provider order entry mandatory. So that took leadership from the administration and particularly from the chief medical officer, Dr. Ratchek. And so it's also important to have that kind of leadership and buy-in. One thing I wish we had done more is measure before we went live, so we could measure afterwards. I've mentioned that we measured blood transfusions and that we measured time for delivery of medications, but we didn't measure much more than that, and so it's hard to afterwards measure. For example, when you first go live with something and people are just learning it, it feels like it takes longer to do something, and it probably does initially. But we didn't measure before we went live with computerized provider order entry how long it took the physician themselves to do certain tasks. Like, say you had to go find the paper record and then write things and things like. And so we didn't have data on how much it took before and how much it took afterwards. So I would recommend to folks that they pick more than 2 or 3. You probably wouldn't want to pick 100, but maybe 10 things to measure before and afterwards, because it costs a lot of money and takes a lot of effort to put in an electronic health record. And so you want to be able to measure tangible benefits from it and have people be able to articulate that, not only to your clinicians, but to the people paying the bills.